We are getting to the heart of it today with Dr. Joseph Walsh. He's a structural heart interventional cardiologist at St. Alphonsus. Their structural heart program recently earned the highest 3-star rating for TAVR, a minimally invasive procedure that's helping patients feel better faster. Dr. Walsh joins us to explain what TAVR is and how it helps, and how personalized care is making a difference for patients right here in the Treasure Valley. Dr. Walsh, so great to have you.
Hi, Melissa. How are you?
All right, I'm great, thank you. And I want to begin right off the top. What is a TAVR procedure?
Yeah, so TAVR stands for transcatheter aortic valve replacement.
Okay.
And historically, when patients had valve problems, they had to undergo open heart surgery, which was a big deal for patients because it's a sternotomy, it's 5 days in the hospital, it's a lot of recovery. And when we got very good at that procedure, we needed more. And so innovative techniques, new imaging modalities allowed us to now perform valve replacements through the leg, through a tiny incision, and allows the patient to recover faster and have the same outcomes as surgery. And we've been doing this for about 15 years, and we've gone through multiple clinical trials, and it's now gotten to the point where it's a 30-minute procedure. The patient's up walking around in 2 to 4 hours.
Wow.
And they can actually go home the same day after a major valve replacement.
That's huge.
It's been very transformative as a cardiologist to see this space kind of develop and innovate through it.
Absolutely. Okay, so help us understand though too, what causes the narrowing of the aortic valve and who typically needs TAVR?
Yeah, so it's a very morbid, mortal condition actually.
Okay.
The aortic valve is the most important valve in the heart. It's the main door between your heart's pumping chamber and the rest of your body. And as you get older, just like any other door, that door can develop rust at its hinges. And so instead of opening like this and allowing all the blood flow to escape your heart, it's rustage closed and essentially can't open. So this forces the heart to work a lot harder. It causes patients to have very severe life-limiting shortness of breath, chest pain, causes them to pass out, and if left untreated, it can cause patients to actually die. And so it's great to have this procedure available because patients who otherwise would not be able to get open heart surgery can now have this as an option, and we've now even started using it in patients that are low risk or wouldn't need open heart surgery.
Okay, and I want to hear why you and the structural heart team at St. Alphonsus are so passionate about this procedure.
Yeah, I mean, I got hooked the first time I saw a TAVR to become a structural heart interventionalist. It is probably one of the most gratifying procedures that exist. Really, within the span of 30 minutes, you take a patient from death's door to an amazing quality of life. And you can see them after the procedure, and even their face, it's more red. They come back to clinic and they can do things they never thought they could do before. You really kind of restore life back to some of these patients and allow them to enjoy their life, enjoy their family, enjoy the things they like to do. So it's really one of the most gratifying things.
That's very profound. Right, like you said, death's door to all of a sudden just living this fantastic life. Okay, so tell us a little bit more though too about the structural heart program.
Yeah, so I've been here for 5 years. The structural heart program has been around for about 8 years, and structural heart basically refers to catheter-based procedures that have replaced surgical techniques. And so through some of the innovations with imaging like ultrasound, CT scans, we can now see into the heart without actually opening it and doing surgery.
Amazing.
And so using these techniques with X-ray and ultrasound and CT scan, we can now perform pretty much the full array of surgical procedures that would otherwise be required. So we fix and repair heart valves, we replace heart valves, we close holes in the heart, we put all sorts of devices in the heart. And the best part is that we get the same outcomes as surgery without any of the recovery, right? And so often patients are focused on their incision or the recovery. They can't focus on how much better they feel. And so that's really one of the most gratifying parts of structural heart. So we've got a great team. We have 4 physicians. We have 3 great coordinators, 2 advanced practice coordinators, imaging people. It's a full team, and we all work together very well and enjoy what we do.
It is absolutely fascinating what you can do this day and age. Okay, so your team, by the way, just earned the top 3-star rating from STS and ACC. So what does this mean to you and to your team and to the patients here in the Treasure Valley?
Yeah, it's very exciting, honestly. So STS and ACC are some of the organizations that oversee heart care, and we report all of our outcomes to them. And so if there's a death, if there's a complication, if there's a stroke, we have to report all of that to these organizations, and they monitor it. And they give each organization, or each hospital, I should say, a star rating. And that star rating basically is a reflection of what your outcomes are. So the best centers in the world get 3 stars. The okay centers get 2 stars, not so great centers get 1 star. So we purposely set out to achieve this goal and achieve this 3-star rating. And it basically means that we're in the top 10% in the entire country.
Wow.
And that our outcomes are on par with Mayo Clinic, Cleveland Clinic. So patients here in the Treasure Valley, if you want the best world-class care, you don't have to go any of these fancy places. You can come right here to St. Alphonsus and we'll take great care of you.
Oh, that is so reassuring.
Yeah.
Thank you, thank you. Okay, so where can our viewers go to learn more about the St. Alphonsus Structural Heart Team and TAVR in particular?
So you can go online to www.stalphonsus.org and you can search for structural heart. And you'll see all sorts of great videos, overviews of what we do, patient stories, so it's really nice.
Wonderful. Dr. Walsh, thank you.
Thank you, Melissa. Appreciate it.